Hi everyone, it's Satoko. How's it going? Have you ever got checked your vitamin D level? Well, this summer I got all the physical done and a blood test done, and then I got vitamin D level checked as well. And I found out I had vitamin D deficiency. And so I was like, so what does that mean? What do I do? What should I take? What should I eat? All sorts of questions. And I did some research on vitamin D and I wanted to share with you guys all. So maybe you can go get your vitamin D level checked. So as everybody knows, vitamin D is a sunshine vitamin. So today in Canada, it's a December and I'm wearing this bright dress as if I'm in Miami and hoping to give all those sunshine to everybody. So vitamin D, 75% of people are lacking, and I was one of them. And if you have deficiency, 11 times likely to get cold and flu. And if you're taking supplement, it reduces cold and flu by 42%. So it's very important to take supplements. On the statistics side, if you have enough vitamin D level, survival rate on COVID is higher. In other words, majority of the people who didn't survive on COVID had a deficiency in vitamin D. And for women, if you have enough vitamin D level, fibroids are less likely. So in other words, majority of the patients on a fibroid patient had a deficiency in vitamin D. By the way, fibroids is the tumor developed on the surface of the uterus. And what's the sources of vitamin D? And there are 5 of them. Sunlight, as everyone knows, and supplement. That's a major part of resource of vitamin D because not many food contains a vitamin D, so we can't have enough just by foods and also sunlight. For the food, fatty fish, salmon, tuna, trout, mackerel, and fortified foods like cereal, milk, orange juice, and other fruits such as egg yolk, mushroom, and sardine. And the signs of deficiency, I chose 5 of them. And with the vitamin D deficiency, it's hard to pick up apparently until it gets severe. So it's hard to notice. Okay, but 5 of them, poor bone health, because the vitamin D promotes the absorption of calcium. And frequently sick, vitamin D boosts the immune system, immune function. And also hair loss, muscle cramp, back pain will be noticed as well because vitamin D promotes neuromuscular function. And so how do I know if I'm deficient? This is the only way pretty much to find out. That's the blood test. And the name of the blood test is 25-OH-VD blood test. But if you ask your doctor, I want to get blood vitamin D check, they would know anyway. And there are 2 measurements. It's either nanomole per liter or nanogram per milliliter. And normal level was 50 to 25 for nanomoles and 20 to 50 for nanogram. And so there is a debate now, apparently. So 75 nanomoles or 30 nanogram may be necessary for our body to function well with vitamin D. And by the way, my level was 37 and it was nanomoles. It was calculated nanomole. So I took 3,000 international unit IU of vitamin D for 3 months. Just for information, I live in Canada, and Canada medical system is covered by government. However, this vitamin D, it wasn't covered. So I paid $35, but it's well worth it. So I do recommend everybody to be checked, and it was covered by my extended healthcare benefits if you live in Canada, just for your information. And also there is another way, thumb press test. So bring your thumbs like this and thumbs to the chest. It's to the sternum, that's the breastbone, and push it to see if you feel any pain or discomfort. That's related to bone health, apparently. I don't feel anything. Hopefully you don't feel nothing. And also skin color. It's a darker skin, the harder to get absorb the vitamin D. So people with a darker skin especially need to take supplement. And this way. How much vitamin D do I need? So we should aim for 4,000 IU, international unit, per day. That's including your supplement, your sunlight intake, and all the food and everything. And a supplement, it is recommended to take 1,000 IU of vitamin D3. So vitamin D3, that's what you need. Yeah, so more the better, not necessarily with a vitamin D. Too much vitamin D increases the risk of kidney stone. So more the better is not the case here. So 1,000, some people say 2,000, so 1,000 to 2,000. And some people say, well, I'm taking multivitamin, so it's fine. Well, if you look at it, because I take multivitamin as well, if you look at the label, mine has 166.6 IU of vitamin D per capsule. And I take one in the morning, one at night, so that would be 333 IU, which wouldn't be enough. So I do take 1,000 of vitamin D as well, so total about 1,333 per day. I hope that's enough, and I'm going to get tested done in a couple of weeks, so hopefully I have enough vitamin D in my blood this time. So I hope you enjoy this video, and I hope you start taking vitamin D and get your vitamin D checked out. Okay? Thanks for watching. Bye.